In general, just review for treatment of coronary artery disease. We have many options for treatment, including lifestyle modification and modulation, medical treatment, including anti-ischemic measure and PCI and CABG, and with alternative treatment, all dealing with to reduce symptom and treating the underlying causes of coronary artery disease. Just review for conventional medical therapy commonly used for ischemic heart disease, including beta blocker, which reduced heart rate and contractility, calcium channel blocking agent, act as arterial vasodilator and decrease heart rate and contractility, nitrate act as venous arterial dilator, antiplatelet agent for anti-inflammatory activity, AC inhibitor and ARBs improve endothelial function and for anti-inflammatory activity, statin group improve endothelial function, anti-inflammatory activity, and have lipid lowering agent. We have many treatment gaps in chronic ischemic heart disease. Many patients have relative intolerance to maximum doses of traditional anti-anginal treatment، يعني يصير عندهم tolerance للتريتمنت وممكن يصير عندهم side effect and poor compliance with the treatment. Many patients continue to experience, despite of full doses of anti-ischemia, experienced myocardial ischemia, and sometimes when we use beta blockers agent with calcium channel blocking, they have both similar depressive hemodynamic and electrophysiologic effect. These resemble the treatment gaps of chronic ischemic heart disease. In general, مثل ما ذكرنا بمحاضرات سابقة, we have a recurrent angina after BCI 15 up to 20% at 2 years, and after CABG we have 10% of recurrent of angina after 1 year of doing CABG. Repeated revascularization we are in need after BCI بحوالي 10 up to 20% after 2 years, and after CABG 25% after 2 years, and the patient may need another CABG which is called redo CABG. The magnitude of the problem: there is a significant number of patients, 5 up to 21% of patients with ischemic heart disease are not optimal candidate for revascularization. يعني المريض عنده ischemic heart disease وياخذ full treatment و still complaining of ischemic chest pain ويحتاج BCI and CABG، لكن ما نقدر نسوي هي patient are not candidate for revascularization, or the patient receive incomplete revascularization with these procedure. Many of them have residual angina and congestive heart failure بالرغم انه ياخذ full medical treatment، فيبقى المريض عنده residual pattern of angina and element of congestive heart failure. So there is need for what is called alternative treatment strategy is needed. هنا عندنا a new subject يبرز لنا which is called refractory angina, and defined by presence of severe angina with objective evidence of ischemia. يعني انت تلقي الساين of الاسكيميا as demonstrated by نسوي للمريض treadmill test or stress imaging study or coronary physiological study, and failure to relieve the symptom with conventional medical treatment and even with revascularization technique اللي هي BCI and الكبد. يعني على full treatment still the patient have ischemic chest pain وانت تكتشف بالTMT او هذه الفحوصات المذكورة سابقا. Patient with refractory angina have دائما يكونون عندهم class 3 or class 4 CCS Canadian College Society، فالمريض هنا يكون عنده marked limitation of ordinary physical activity or unable to perform any ordinary physical activity without discomfort or pain at rest. دائما المريض اللي عنده refractory angina دائما يحتاج نسوي له periodic assessment which is mandatory, and the patient may amenable for revascularization at any time. يعني المريض هو refractory angina وقلنا full anti-ischemic measure و not candidate for CABG or PCI، دائما نسوي له نسوي له periodic assessment، لأنه في أي وقت تتحسن الأمور بسبب development of collateralization، وبأي وقت ممكن المريض amenable for revascularization with BCI or CABG. What is refractory angina? Refractory angina have 6 criteria. Canadian College Society class 3 or 4 وهذا ذكرنا سابقا. Duration of symptom more than 3 months and the patient has coronary artery disease per se، يعني مو secondary causes، مو anemia و thyrotoxicosis or pregnancy or hyperdynamic circulation اللي يسوي لي ممكن angina. لا، احنا هنا البرايمري كوز والكوز يكون stenotic lesion بالcoronary artery. For objective evidence of reversible myocardial ischemia، يعني نسوي له TMT ويصير عنده reversible، يصير عنده ST T wave changes during TMT ويصير reversion لها بعد ال TMT. مثال على ذلك patient on full medical therapy and patient not suitable for BCI or CABG. Why the patient inappropriate for revascularization or the causes of inappropriate revascularization؟ ممكن يكون اللوكيشن of the stenosis مثلا هو مسوي سابقا كابج فنخاف من الجرافت ستينوسيس نفسيته، أو يصير ديستال ستينوسيس بالارتري نفسيته، or there is multiple stenosis or combination of all these previously mentioned factor. Potential risk of damaging of pre-existing graft، نخاف من نسوي عملية أو نخاف من نسوي BCI ممكن يصير دمج للبري-existing graft. Often the reason for rejection was a combination of all these mentioned factors. High-risk patient with regard to both CABG and BCI due to comorbidity، طبعا ممكن المريض عنده renal failure، عنده CV، عنده stroke or old age or coronary anatomy are unsuitable for revascularization. يعني يعني المريض عنده مثلا congenital abnormality of the coronary، عنده difficult ugly anatomy of coronary artery، then كلهن causes ممكن for inappropriate revascularization. Another factor هو lack of graft، يعني المريض عنده amputation of both lower limb والمريض not have a good graft for revascularization, or patient had diffuse sclerotic changes and impaired LV function عنده sign or of failure, or patient with previous BCI or CABG وعنده sign of systolic LV function. كل هاي الكوزز اللي قلناها ممكن تكون مسؤولة or supposed to be a cause of inappropriate causes of revascularization. Alternative therapy option for refractory angina either pharmacological or non-pharmacological. الفارماكولوجيكال which is non-traditional، مو ذنيك اللي ذكرناها سابقا، ممكن تشمل لنا الرانوليزين، ترايميتازيدين، نيكورانديل، إيفابرادين، فاسوديل. إيفابرادين ونيكورانديل احنا حاكين عليهم سابقا محاضرات سابقة. non-pharmacological مثلا EECB external enhanced counter pulsation، transmyocardial revascularization، chelation therapy، spinal cord stimulation، وcoronary sinus occlusion or reducer، gene therapy، coronary venous arterialization and heart transplantation. In general medical therapy trimetazidine which is metabolic agent يزود لنا الميتابوليك efficacy of myocyte، يقلل لنا الفاتي أسيد ميتابوليزم ويزود لنا glucose metabolism، and by this it will enhance coronary blood flow، لأنه الفات metabolism need much more ATP، much more need for oxygen demand of the heart and make the anginal heart more worsen. So change the fatty acid metabolism to glucose metabolism. Ranolazine piperazine derivative also shift metabolism of the myocyte from fatty acid to glucose, and it has unique anti-ischemic effect with no affection on the heart rate and blood pressure. Ivabradine سابقا قلنا عليها, which is selective effect of conduction system on the SA node, ويشتغل لنا على الأيودين funny channel of SA node, causing slowing of heart rate during peak exercise and shift the patient from high risk to lower risk, reduce myocardial infarction event, and it has no negative inotropic effect. وعندنا ملاحظة, كل ما كانت الهارت ريت above 70, it will increase the risk of coronary revascularization by 38%. Nucarandil, which is potassium channel activator, it has a dual action, decrease preload and afterload. البريلود هو include الالفي diastolic function سواء الكومبلاينس dimension or pressure, والافترلود هو البريشر of the aorta. Fasudil refer to Rho kinase inhibitor and it has vasodilator activity. How does trimetazidine work? In anginal patient, there is accumulation of a free fatty acid, which the cardiac muscle oxidize for their energy requirement, اللي تحتاج المايوسايت for their action and for contraction of the heart. Free fatty acid need much more ATP to break down and to release energy for myocyte than glucose oxidation. And this in need for more O2 and more blood supply for anginal heart. And this will cause more burden effect on the anginal heart. So this prevent by trimetazidine, which shift the metabolism from long-chain fatty acid to glucose. رانوليزين يعني هو الاسم التجاري موجود, Renaxa 500 mg by 2 and can increase to 1000 mg by 2 and should be given with a beta blocker, amlodipine or nitrate. It improves survival rate, increase the exercise ability of the heart, ويزود لنا الفري anginal period and may improve glycosylated HB in diabetic patient. So may increase insulin sensitivity. بنفس الطريقة الترايميتازيدين, it is a partial inhibitor of fatty acid oxidation. عنده side effect ممكن يسوي لنا prolongation of QT interval. So should be given with caution and should be avoided in patient using other drug causing QT interval prolongation. Ranolazine, if used with digoxin, antipsychotic, antidepressant, simvastatin, all those should be reduced their dose because ranolazine may causing toxicity of these drug because it has liver enzyme inhibitor activity. Fasudil hydrochloride, which is a potent Rho kinase inhibitor, and it has vasodilatation effect. Rho kinase, which is a protein and involved in a variety of biochemical signal in the cell and in the myocyte. Fasudil is used for cerebral vasospasm treatment. ممكن نستخدمه in patient with memory decline كما في stroke and in patient with Alzheimer, وممكن نستخدمه كذلك as alternative treatment in patient with ischemic heart disease, supposing they have coronary vasospasm. Because Rho kinase causes hypercontractility of vascular smooth muscle, and this will induce coronary artery spasm. So inhibition of Rho kinase protein help blood vessels to relax and increase blood flow and blood supply to the cardiac tissue. So this form is the basis of use in coronary artery disease, but spasm احنا دائما نعرف مو دائما السبازم موجودة بالcoronary artery disease, and some of patients may have spasm superimposed over the stenotic plaque. Enhanced external counter pulsation. حقيقة هذا يعني متوفر في بعض المحافظات، بالنجف موجود. وهو يوز multiple cuff over the thigh, over the lower limb bilaterally. وهنا نحتاج 3-5 hours total time for treatment in 5 days per week per 7 weeks. كل سيشن يتراوح من ساعة إلى ساعتين. And it is non-invasive outpatient therapy. والكومبريشن هنا يكون pneumatic external compression of lower limb، والبيشنت يكون مربوط على ECG device. والكومبريشن of these cuffs يصير ينفخن during the diastolic phase of the heart. يعني بالسيستول يفشون، بالدايستول يصير بهم inflation to increase diastolic aortic pressure, to improve diastolic flow of coronary artery, and this may improve coronary circulation. Contraindication for EECB include arrhythmias, bleeding tendency, active thrombophlebitis, and lower limb active vaso-occlusive disease, presence of significant abdominal aortic aneurysm or dissection, pregnancy, decompensated heart failure, severe aortic regurgitation, severe hypertension, more than 180 over 110 millimeter mercury, severe chronic obstructive lung disease. The EECB and the side effect including paresthesia, skin abrasion or ecchymosis, bruises, worsening of the heart failure in patients with arrhythmias, leg or waist pain, and edema. Sometimes patient poorly complies with EECB. TMR, transmyocardial laser revascularization, by utilization of laser to create a channel within myocardium, either surgical pathway ندخل خلال الابيكارديال approach or percutaneous through femoral artery retrogradely، ونروح ندخل through endocardial approach by making transmyocardial channel which connect LV cavity to the myocardium, and this mimicking the physiology of the blood flow in normal heart. Patients with poor LV ejection fraction are not good candidate for TMR. Neurotransmulation for palliation of angina by interruption in سوي or modification of afferent segment. By interruption or modification of the afferent signals. More recent study using transcutaneous electrical nerve stimulation and spinal cord stimulation. They act by reducing the activation of central pain receptor, and there is a reduction in sympathetic discharge leading to decrease in the cardiac workload and myocardial oxygen demand. وهنا يحتاجون المريض حتى نطبق عليه نيورو ستيميوليشن، يزرعوا لهم أجهزة بالقريبة على السباينال كورد to stimulate السباينال cord for emerging signals or for modulation of pain perception. Contraindication for neurotransmulation include unstable angina, unfavorable physical condition, cardiac pacemaker or intracardiac defibrillator, lack of patient compliance, obvious infection, allergy, immune response to implanted material، لأن احنا نحتاج material حتى نزرعها بالspinal cord, or the patient with anticoagulation that might increase bleeding at the implantation site. Gene therapy, gene encoding protein including growth factor to enhance myocardial angiogenesis، وهذا الفاكتور قد يكون vascular endothelial growth factor or fibroblast growth factor، ونستخدمه with multiple delivery method، ممكن طريقة الانترافينوس، طريقة intracoronary or intracardiac injection of the gene. We have three processes involving in gene therapy. Vasculogenesis هو formation of new vasculature structure باستخدام انه stem cell، وهاي ممكن نستخدمها بالembryogenesis period and maybe contribute to adult new بالمستقبل يصير عندهم new vascularization، ممكن نستخدمها يعني in embryonic state بالفاميلي اللي عندهم hereditary causes of ischemic heart disease مثلا. أو angiogenesis هو formation of thin walled endothelium باستخدام الجين ثيرابي but there is lacking of smooth muscle layer. Arterialization هو formation of the vessels with complete smooth muscle layer. نقطة أخرى هو الكوروناري ساينس اوكلوجن. احنا مثل ما ذكرنا سابقا الكوروناري ساينس which is considered as a fifth chamber of the heart. Coronary sinus which collect the venous blood of the coronary veins and return it back to be open in the right atrium. فهنا يسوون occlusion or reducing the size of the coronary sinus and making retrograde pressure to the arterial system of the coronary and may improve the perfusion pressure in the coronary, enhancing the myocyte contractility. By occluding this conduit, leading to redistribution of the blood already in the coronary system into relatively under-perfused or ischemic territory, and creating controlled narrowing to modulate flow and elevated coronary sinus blood pressure, which increase endocardial perfusion, providing relief of ischemia. موضوع آخر اسمه Percutaneous in Situ Coronary Venous Arterialization، وهذا ضمن surgical alternative treatment of the patient with refractory angina, which refer to percutaneous approach that redirected the arterial blood from the occluded artery into an adjacent coronary vein, then redirected back to the coronary artery after the occluded lesion of the artery, thereby making arterialization of the vein and providing reperfusion to ischemic myocardium. يعني عندي coronary artery بي occlusion وبصفة coronary vein، فنربط الcoronary artery قبل الليجن بالcoronary vein، وبعدين نرجع نربط الcoronary vein بعد الليجن مالت الcoronary artery بالcoronary artery itself، فنسوي new conduit after the obstructive lesion of the coronary artery. Even in the most severe cases، هاي ملاحظة، حتى لو in the most severe cases of coronary artery disease, the coronary venous system is generally free of atherosclerosis. And thank you.